Ransomware doesn't just lock a laptop anymore. In a hospital or healthcare setting, it can take an EHR system offline, delay surgeries, and put patient lives at risk. Data breaches in healthcare regularly expose millions of records at once. And yet, when it's time to decide where to invest in the cybersecurity budget, most healthcare organizations are still working from compliance checklists or generic risk scores that were never built to answer the one question every executive actually needs answered. What will this cost us and how likely is it to happen? That's the gap cyber risk quantification closes. CRQ takes potential cyber events like ransomware, a data breach, or a business interruption and translates them into financial and operational terms. Instead of a red, yellow, green heat map, you get a number, the likely dollar impact of an event, and the probability it happens in the next year. That's a language a CISO, a compliance officer, and a hospital board member can all read the same way. For healthcare specifically, that shift matters because the stakes go beyond the balance sheet. When you can quantify what EHR downtime actually costs or what a ransomware event does to your ability to deliver care, you're not just protecting revenue, you're protecting your ability to treat patients. That's the core value CRQ brings to clinical operations. It also changes how you handle trust and compliance. Every healthcare organization is under pressure to safeguard patient data and stay ahead of HIPAA reporting obligations. Quantified risk data gives you something a checklist can't. Defensible numbers you can put directly into a cyber risk register, hand to an OCR auditor, or use to justify a security investment in terms a finance team will actually respect. And because everyone, your CISO, your compliance lead, your health system executives, is now looking at the same financial exposure figures, cyber risk stops being a security team problem and becomes a shared enterprise-wide priority. That alignment shows up again when you're talking to your board or your insurer. Instead of describing risk in abstract terms, you're demonstrating governance and justifying investments and budgeting requests with numbers everyone can defend. One more thing worth knowing, this isn't just for the largest hospital networks. Because the model scales to an organization's size and technology stack, it works whether you're running a multi-site health system or a single clinician's practice. The scenarios get tailored to you, so the output is just as useful for a boardroom decision as it is for a Tuesday afternoon security call. The bottom line, healthcare cyber risk isn't going away, and it isn't optional to manage. What CRQ changes is whether you're managing it with a guess or with a number you can actually stand behind. If you want to see what that looks like for your own organization, book a demo with us today.